Yes, sir.
Will the private insurance companies be required to cover everything? I mean, are they going to be able to deny coverage like they do now? I have a friend who has a friend who just found out she has breast cancer, and she also found out that it's not going to be covered.
You know, I don't know if you heard that question. Some friend has breast cancer and she's told by her insurance company.
A friend, I don't know.
A friend of a friend, okay. Told that she's not covered. I'll tell you what I proposed in our state, and it's something that each state has to think about how they want to do it. And that is, I propose that there be a quasi-public board. We call it the connector. And that they look at the plans that insurance companies are offering and put a stamp of approval on the ones that cover the diseases people get. So you make sure you don't pay money for something and then when you get sick find out it doesn't cover anything. And so you basically have a seal of approval. My legislature took it one step further. They said they're not going to allow anything to be sold in our state unless it has that seal of approval. And so now we have a body that looks at the policies medical or insurance companies offer to make sure they cover the needs of our citizens. And I think it makes sense for people to be aware of what they're buying. I sometimes see ads for health insurance policies that are, you know, $50 a month or $100 a month, and I know enough about insurance to know that that's not going to cover the kinds of conditions people are going to be subject to, unless it's a comprehensive only, or excuse me, a catastrophic only plan matched with a health savings account, which is another option. But you surely want to have health policies cover the diseases such as breast cancer that people get.
Does this still allow for denials then?
When you say does it still allow for denials?
Yeah, your board of approval. I mean, I don't want to find out when I go to the hospital that I've got some rare disease they're not going to cover, and the board of approval didn't approve it.
Well, the board of approval approves the policies to make sure the policies cover the diseases people receive, and that's something which each board will have to decide what's going to be included. But people understand what the deal is, what kind of insurance they're getting, and I think you have to have, if you have catastrophic care, or you have catastrophic illness like breast cancer, it ought to be covered. I can't imagine a circumstance. I can't imagine a circumstance where insurance would deny coverage for breast cancer. That makes no sense to me at all. And I don't know whether that's allowable here in Iowa, but I sure hope it's not allowable in my state. Thank you. Yes, sir.
I got a